Welcome back to Rook's Health. My name is Farouk, and today we're going to be talking about the health and care worker visa versus the skilled workers visa, which was formerly known as the Tier 2 working visa. Now, these two visas are what majority of individuals coming to look for work in the United Kingdom will be applying towards. And there are other visas in place that you can apply to, and there are many other types of ways to come into the UK to work. You have visitors visa, but today we're going to be focusing on the differences between these skilled workers visa and the health and care visa. That primarily is because these two are almost very, very similar from each other, as well as different from each other as well. But let's begin with the definitions of each of these visas to start off with, to be honest. So you have the skilled workers visa, which is more of a blanket visa, which allows any skilled worker falling under the correct occupation come into the UK and gain work. This visa allows you to work, and you can get it anywhere from 3 years to 5 years for this visa. On the other hand, the health and care visa is in its name. It's specifically for healthcare workers looking to get a job in either NHS and NHS supplier or social care. Now, I've covered this visa in itself in a separate video, which you can check out as well on the channel. But the primary difference between the two, in my opinion, what I know it to be, is that obviously the health and care visa is for health and care workers in terms that it allows specifically nurses, physiotherapists, doctors, radiographers, people working within the NHS system, a faster track and a different track to get it. So actually, prior to I think December 2020, before this visa in itself was introduced, the health and care visa, everyone was applying under the skilled workers visa, and your job had to be under this occupational shortage. That's something we'll come into later on as well. But now they've kind of segregated it in a sense where they made it a little bit easier for healthcare workers due to supply and demand in the UK to get healthcare jobs. For the most part of it, to be honest, the way you will apply for these visas, the skilled workers visa and the health and care workers visa, are similar. Most of the elements and the requirements of what you'll need are very, very similar in terms of what documents you'll need to prove. Do you need to prove your English? Do you need to show how much finances you have in your account? Most of these elements will actually be the same. However, there are some very core differences that actually, I'll be honest, it favors heavily healthcare workers, and it makes the whole process a lot easier and a lot cheaper, which is what a lot of people will be concerned about, because I'll be honest, to apply for a skilled workers visa, it can be very expensive. You have to come and get work here, you have to pay quite a bit in terms of application fees and everything else. But let us talk about the differences between the two of them, just so you can have a brief synopsis as to what's actually the difference, and is it just more of a words fancy lingo that they're trying to use to confuse people, or is there actually substance to the splitting of these visas? So the primary difference, and actually not the primary, one of the main differences is health surcharge. Now, currently, if you want to come into the UK and work and apply for the skilled workers visa, prior to everything, the skilled workers visa currently, you would be paying £624 per year. That is the current rate on the government website that you says for the health surcharge. And this is not a one-off fee of £624. If you're applying for a 5 years visa, that would be £624 times 5. So you're going to have to pay that. That's the NHS health surcharge. And students pay it as well. Coming into when you're applying for a student visa, you're going to be paying that fee. But with the health and care visa, that fee has been waived. You're not going to be paying to use the NHS because you're working in the NHS, which makes a lot of sense, to be honest. Now, this in itself is a very, very big bonus for healthcare workers and makes life easier, because if you imagine that you would normally be paying well over £2,000 for this healthcare surcharge, but that's been waived now, so you don't need to worry about that if you're applying for the health and care visa. However, the skilled workers visa, you're still going to be paying that fee. And also for the skilled workers visa, the application fee is a lot higher, basically double what you would be paying for the health and care visa. At the moment now, the application for a skilled worker, if you're applying for a 3-year visa, is actually $464, and the 5 years visa is $928, which is fairly high for an application fee. And I assume most people who want to come into the UK work are aiming for most of the time a path to naturalization or getting your indefinite leave to remain. So you most likely want to go for that 5 years, and also save yourself the trouble of doing it again in 3 years. So that's almost £1,000 for that application fee. On top of that, you're paying the health care surcharge. However, for the health and care surcharge, that's basically half the price for both the 3 years as well as the 5 years. I'm going to put the numbers up on the screen now because I don't remember them off the top of my head. But basically, it's a significantly less price. And that's mostly of all the fees you'll be needing to pay as for the health and care visa. Significantly less. Okay. And for the most part of it, most of the documents you'll be needing for applying for both of them will be the same. So if, for example, which very unlikely that you would have been preparing for the skilled workers visa, but if you were already and then you find out that, oh, actually, I think I'm not supposed to be applying for the skilled workers visa, I'm supposed to be applying for the health and care workers visa. Most of the documents you've already started to prepare will be similar. Look at the website, the government website, and check out my other videos so you can see the main differences of what you need specifically for the health and care visa. But to be honest, if you've been working towards the skilled workers visa and then you find out you have to do the health and care, that's a bonus for you, to be honest, because you're going to be saving a lot more money, and that can go towards other things as well. But again, most of the things, cost letters, certificate of sponsorship letters, your proof of finances, your knowledge of English, all will remain the same. Most of these changes happened around 2020, so I think the latter half of 2020 and the beginning of 2021, when most of these changes started to occur, due to, well, multiple reasons, but we'll name it to the global incident that has happened to us now, and that drive and need of healthcare workers, because I'll be honest, there's still shortages of healthcare workers here in the UK within the NHS. You have shortage of nurses, you have shortage of therapists, doctors, and I don't see this changing in the foreseeable future with only sourcing local staff. So they realize that there's a desperate need for foreign staff and people coming from abroad. So hopefully this gives you a nice idea as to what the differences between the two are, because there's a difference and you just need to make sure you know what you're applying for. Most of the time you will be directed, if you're going to on the skilled worker tier 2 government website, you should see, and it says if you're applying for healthcare workers, go to this one as well. Again, I've covered quite a few lists on different topics on different specific occupations. If you're not sure if your occupation is actually under the health and care workers visa or it's under skilled workers, you can check out some of the links below and just make sure you see that list and check out. And I might just let it run by my side, so you can, feel free to look at for health and care workers visa, make sure you know which one you're applying for and what the main difference. But hopefully that's been helpful, and go watch some other videos. Thank you very much for your time. Take care.